All right, we are now officially recording. So again, welcome to the Health Ambassadors for People Experiencing Homelessness Request for Applications Review webinar. My name is Madeline Sabatoni, and I'm a program officer with the Center at Sierra Health Foundation. So our agenda today, we're going to provide some background on this funding opportunity and the opportunity itself. We'll talk about how to apply and how to be competitive. Just a little background on the Center at Sierra Health Foundation. We were launched in 2012. We bring people, ideas, and infrastructure together to create positive change in California, and we're dedicated to health and racial equity. We are the managing entity of the Health Ambassadors for People Experiencing Homelessness program in partnership with the California Department of Public Health. I'm going to hand the mic over to my colleagues at the California Department of Public Health, Molly Lund and Pike Long, who will give a little bit of a background on this funding opportunity.
Good morning, everybody. Really great to see such an amazing turnout. My name is Pike Long. I use she and they pronouns, and I am one of the two housing and homelessness equity specialists here at the California Department of Public Health. So as you can see, federal COVID-19 funds have enabled us to launch a pilot peer health ambassador program for people experiencing homelessness. Throughout this funding opportunity, we, CDPH Office of Health Equity, Molly and myself are going to work really closely with the Center at Sierra Health Foundation and Homebase. So we'll be sort of in the wings, making sure things are going as planned. Molly, you want to introduce yourself?
Yes. Hi, everyone. My name is Molly Lund. My pronouns are she, her, and I'm the other Housing and Homelessness Equity Specialist at CDPH, and we're in the Office of Health Equity. So we're really excited to fund grantees who are going to employ, mentor, and train people with current or lived experience of homelessness to become peer health ambassadors to other people experiencing homelessness through this program. And we have the aspiration that eventually we will secure ongoing funding for peer ambassador programs for people experiencing homelessness and other vulnerable populations. And we will pass it back to Madeline.
Thank you so much. And now I would like to pass it over to Homebase, who will serve as a technical assistance provider for this opportunity, and they're going to provide some background on health ambassador programs.
Thank you so much. Hello, I'm Jean Field, and I'm here with my colleague, Jillian Marchetti from Homebase. You can forward to the next slide. Hi. And Homebase is what we call a technical assistance firm that has subject matter expertise, particularly in homelessness and cross-system coordination. And Jillian is one of our in-house experts in homeless response and healthcare systems and how to align those systems for a more effective community response. We work in a number of communities in California and across the country, both rural and urban. And we've developed a lot of expertise from those communities, and we really enjoy and feel very privileged to be able to share the lessons that we've learned from communities who are doing this work effectively with other communities. And that way we build community capacity across California. So in advance, we're really excited to work with all of the folks on the call, and we hope to help communities put together innovative and sustainable systems to help people experiencing homelessness. And with that, I'm going to pass it off to Jillian.
Thanks, Jean. Hi, everyone. I'm Jillian Marchetti, she, her, also from Homebase, as Jean mentioned. You can go ahead to the next slide, Alan. So I'm going to share with y'all, we're going to both collectively, Jean and I are both going to share with you a little bit more information on kind of how to conceptualize the idea of health ambassadors and why health ambassadors could be so important in terms of better serving folks experiencing homelessness in your communities. And then we'll also give a little bit of information about like what different programs that have been created in some communities look like to give you a sense of what you might want to work towards creating yourself. You can go to the next slide. So just for some context, when we're talking about, why health ambassador programs, why are we hoping to help support communities to build some of these up? So some of this information might be well known or kind of background to some of you on the call, but wanting to kind of level set for everyone and just sort of acknowledge that there is a need, pretty significant need for better healthcare access for folks experiencing homelessness. So many people are familiar with this concept, but again, just to provide some foundation for this morning, people experiencing homelessness are at greater risk for poor health. And we know that for various reasons, and there's lots of explanations and there's lots of evidence behind that. But essentially, folks experiencing homelessness are often in more contact with communicable diseases and infections. They're, especially if they're living unsheltered, are exposed to extreme weathers throughout the year, depending on where they're living, malnutrition and stress and lack of running water to maintain cleanliness. Often folks can't or don't have access to refrigeration for medication. We see higher rates of infectious and acute illnesses and chronic diseases and poor mental health or substance use disorders, as well as just, especially for folks living outside, again, potentially being victims of violence as well. And we know that there are higher mortality rates, up to 3 times higher than the general population for folks experiencing homelessness. So we know that, right, that there are greater health risks for folks experiencing homelessness. And also just that the experience of homelessness often inhibits the consistent care, the long-term care that's often needed for some of these health conditions, which then aggravates the conditions themselves and makes them more dangerous for folks. And on the other hand, and kind of in addition to these higher rates of greater risks for poor health outcomes, people experiencing homelessness also have a lot of barriers to effectively access the healthcare system. And that's true even if they're enrolled in Medi-Cal or some other insurance program. So the barriers to accessing the health system in an effective way, again, there's various reasons for that. There's often, among both people experiencing homelessness and the providers in the homeless service system who are working with them, there's often a lack, just a lack of a knowledge of the resources that are available through the health system in various ways, a lack of understanding of how to actually access those resources, even if you're aware of what's out there. I mean, even accessing especially like behavioral healthcare services can be really difficult, especially if you're needing kind of immediate or walk-in options. There's often really long wait times for appointments for things, and even things as basic as just transportation or the ability to get to health appointments, to help keep track of scheduled appointments, things like that. So lots of barriers to just simply knowing about and accessing health resources, and also a really very understandable and historically entrenched distrust of the health system on the part of many people experiencing homelessness, especially amongst Black and Indigenous and other people of color, due to histories of unnecessary or unsafe or non-consensual medical experimentation or systemic medical violence against people of color. Is a really real reality in history for folks in this country. And so there's lots of reasons that people might be especially within certain groups, a bit hesitant to access health systems, even if there is an awareness of how to do so. There's also, again, due to a lot of the different realities of folks experiencing homelessness, it's difficult to have any kind of consistent care, even if you do connect, a lack of follow-up or ability to kind of maintain contact with a primary care provider, for example, or any other provider you're working with. Health systems are not designed with folks experiencing homelessness in mind. And so the structures that are in place can be really difficult to navigate and get access to. And also there's just simply, as with a lot of different systems that are set up to help people, there's a lack of representation of the people that are most impacted, right? As far as like the planning and the implementation and the process of actually operating health systems and other systems of care. So again, lots of reasons that it's difficult for folks experiencing homelessness to get the access to the care that would be most needed for them. And it's particularly true for preventative healthcare, things like, what we're here to talk, part of what we're here to talk about, things like vaccinations and kind of staying on top of preventing risks in the first place. For a lot of people experiencing homelessness, the emergency department is sometimes the only option for receiving any kind of primary care. And so to the extent that folks do access the health system, it's often in a reactive or on demand to kind of urgent situations. And so there is really a particularly high need for any kind of like preventative health or ongoing care that can help alleviate some of the higher risks that we see in this population. Next slide. And we also know since we're talking not entirely about vaccinations for infectious diseases, but in part that, we also wanted to just kind of acknowledge that among the health risks or the poor health outcomes that we generally see compared to the overall population for folks experiencing homelessness, especially folks who have been experiencing homelessness long-term, there's higher susceptibility to symptomatic infection, not just due to the fact that across the United States, the population of folks experiencing homelessness is an aging population as well, but also just due to the physical decline and the mental weathering that can occur from just repeated exposure to harsh elements that are, the realities of folks, especially who are living unsheltered. And as we know from the experience of COVID-19, especially, but not just COVID-19, folks who are experiencing homelessness, whether they're either unsheltered or perhaps living in what are usually congregate or like group shelter settings, which can really impact people's ability to access really critical information and resources that are relating to health and safety, to be able to distance and isolate themselves if there is something like, a COVID-19 illness spreading around, and to just maintain good hygiene practices and sanitation, which we've obviously seen again in the past few years are really critical for protecting oneself against certain illnesses that are spreading. And just this last bullet is kind of just a specific example, again, grounded in COVID-19, as just for context, that we've seen that people experiencing homelessness who were infected with COVID-19 were potentially 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die from that than the general or from the overall population. So this is obviously a really critical need that we're trying to address here. And if you go to the next slide, we can start talking about how health ambassador programs specifically can help bridge some of these gaps. Thanks, Madeline. So we know that two strategies are, can improve the health of people experiencing homelessness. And obviously not just this, but to kind of summarize a bit, better access and continuity of care, right? So folks without access to healthcare are, for all the reasons we've talked about already, at really increased risk for later stage diagnoses of diseases, poor control of what should be manageable conditions, and hospitalizations for things that, again, should be preventable. And without any kind of continuity of care, even if folks can access the system, sometimes the trust that's really necessary to improve health outcomes overall over time is nearly impossible to gain. And we know that addressing the healthcare needs of folks who are experiencing homelessness, especially unsheltered people, is really critical to achieving any kind of health equity. Next slide. So in talking specifically about health ambassador programs and how they can help with the kind of context that I've just laid out, the idea of a health ambassador really is to, as folks who have looked at the RFA can see it described, is intended to provide outreach and education around the importance and the efficacy of testing and vaccinations in part, including for COVID-19, but not exclusively, and also other healthcare information. And critical to this is, sharing personal reasons for either confidence in vaccines for folks who maybe are a little bit hesitant or unsure about them, based on their own personal experiences, really helping to connect people to available testing and vaccine resources and other health resources. And the concept of health ambassadors is that they can provide both accurate information, just information about vaccines and testing and other healthcare that's available, directly address questions that folks have, and maybe address some of the reasons that people might be hesitant to access vaccines or other kind of healthcare, and also specifically facilitate connection to healthcare, including vaccinations and testing. And the idea is to use a low pressure, really critically peer-based approach, which I'll talk about a little bit more in a moment, to facilitate like really grounded, just natural conversations between people that have some shared experiences, so that in addition to just providing healthcare information or information about resources, they can really share their own experiences and decision-making processes when they've been in similar situations and maybe at a point where they hadn't necessarily accessed healthcare as well. Because, excuse me, the health ambassador program concept is really grounded in a strength-based, trauma-informed principles that are intended to build respect, between people and mutual understanding. It's informed by proven peer-based outreach and services models that have been long used by behavioral health services, and also have been really growing in use by homeless service systems as well over the past several years. And so obviously really critical is that health ambassador programs can provide those, trusted connections to resources, improve the healthcare literacy and confidence of people experiencing homelessness who have been, disconnected from healthcare services in many cases. And an additional benefit is it can really help. The development of a health ambassador program can really help a community, concretely step forward towards creating more sustainable systems for just overall improving engagement and connections to healthcare for people who are experiencing homelessness, even once, for example, the pandemic is concluded. So that's why we're talking specifically, or we're talking more broadly about health ambassador programs that can include things like COVID-19 response and vaccinations, but can also be focused on just general improvement of healthcare connections. And then also want to just point out the importance of this kind of program for either beginning or strengthening any kind of cross-system collaboration. So many of you might have some sort of partnership or connection between healthcare systems and homeless response systems, in which case this can really be a helpful way to strengthen those partnerships and build a more sustainable collaboration. Or if that partnership is lacking, this can be a really great first step to beginning to build up that connection in a real way to make sure that folks who are experiencing homelessness are connected to housing, and also eventually, and hopefully as part of this, kind of vice versa too, making sure that folks who have greater healthcare needs are also able to access housing as well. Next slide. So I want to talk a bit about the importance of peer specialists, and this is a number of slides, but I'll probably go through them a bit quickly, just so that we have time to answer questions and get to the other content. But if you go to the next slide, we just want to spend a few minutes talking about why the importance of, or what the importance of peers as ambassadors is when you're creating these programs. Next slide. So when we're talking about health ambassador programs, just really want to focus on the importance of ensuring that you're instilling equity into these programs. There's an opportunity to really make sure we're taking specific healthcare needs into consideration. I spoke a little bit about the historical mistrust of the health system by some folks, so really acknowledging and creating these programs and implementing them. Racialized trauma when you're doing program planning, really important to, as with anything, right, center diversity and equity and inclusion and belonging practices into the design of your program and the staffing and the training. And a really critical part of that is integrating peers and peer specialists into your program planning. And so the next few slides, we'll take a look at that a little bit. So you can go to the next slide, Madeline. So just as a very basic framing for peer models, folks talk about peer supporters and peer specialists, and a peer supporter is basically any person who has knowledge from their own lived experience with a condition or a life circumstance of the folks that they're working to help, or has received training to be really empathic and understanding in the context of this work. And so when we're talking about folks experiencing homelessness, a peer would be someone who has either current or previous lived experience of homelessness. When we're talking about a peer specialist specifically, it's a person who not only has that lived experience of, a specific healthcare need or homelessness or recovery from substance use, for example, but who has also been trained and certified to help his or her peers to really gain understanding and be able to achieve specific recovery goals that they might have, or health goals and housing goals. Next slide. So why peer models? Why are we having this health ambassador program be so centered around peers being the ambassadors themselves? We've talked a bit already about the challenges of engaging folks who are experiencing homelessness in healthcare. And so engaging with people who have that shared experience is a really great way to build trust and respect, and also just and a better way to help reach that level of understanding of not just the resources available, but the ways to access them and why you would want to, and keeping folks who are experiencing homelessness or who have previously really actively engaged in healthcare. The concept of peer support, or the model of peer support, is intentionally non-hierarchical, it's reciprocal, it can be very flexible. It can really complement any existing healthcare services or structures that are available. And again, really supports the building of trust and ongoing engagement that's absolutely critical for folks to begin thinking about their own healthcare goals and moving forward to achieving them. And specifically in the context of health ambassador programs, having peer specialists be the health ambassadors themselves really is incredibly important and will improve the efficiency and the effectiveness of any outreach and engagement that's required as part of the health ambassador program. Again, the trust building, I know we repeat that a lot, but it's really, really critical and a huge piece of why it's so important that health ambassadors are peer specialists or folks with lived expertise, because there's that familiarity and support, right? And that shared understanding. And so it really improves the ability to engage with and understand and communicate effectively and in a way that builds that trust that's so important. Next slide. This is just a smattering of the benefits of using peer specialists and peer support. So some of these we've talked about already, but again, just really wanted to emphasize, and I won't read through each of these individually, but really want to emphasize a few of them, that kind of acknowledging that the cultural similarities or the cultural overlap, cultural competence that comes with working with someone who has a shared lived experience as you, is really critical, not just for that individual experience, but involving folks in this work that have that lived experience can really help to build the cultural competence of healthcare providers themselves as well, and other folks who are working in the service systems. It helps, increase the individual and the community capacity overall for really understanding in a more meaningful way what the problems are with accessing healthcare and what solutions might be offered. And helps, the individual folks who are actually needing to access healthcare obviously learn how to advocate for themselves and connect to things and better understand. So its benefits are across the spectrum, including at the individual interpersonal level with folks who the ambassadors will be working with directly, but also is just a way to benefit the system overall, both the homeless response system and the healthcare system, and better understanding what the needs of folks are, what the barriers have been and still are, and identifying strategies to not just connect people directly to resources, but also to overall, again, improve your system so that the barriers are lessened over time systematically. Next slide. And then finally, we just want to mention the importance of and some ways to ensure that your peer models, including a health ambassador program, but this can apply to peer models in general, are equitable. So making sure that your peer ambassadors are trained on equity concepts, ensuring that the folks that are hired to be the health ambassadors are representative of the populations they're supporting. So not just in terms of lived experience, but in other ways as well, demographically and otherwise. Compensation is a really critical piece, which is why we're so thrilled to be supporting communities who are going to get some resources to help launch these, because making sure that ambassadors are fairly compensated for their expertise and their time and their labor is really critical to making sure your models are equitable. And then finally, making sure that folks who would like to be peer specialists and maybe don't already have the requisite or recommended training that might be needed for someone in that role, have the opportunities to actually acquire that training so that they are eligible to serve in these roles. So ensuring that folks who would be interested are able to connect with the training or other support that they need to be successful, to be able to apply for the roles and be successful in those. Next slide. I think at this point, I'm turning it back over to Jean, who's going to talk through what some different health ambassador program models actually look like. Thanks, Jean.
Great, thanks, Jillian. And we welcome any questions that you have. I think we're going to be doing that at the end. But launching from what Jillian talked about, we're very fortunate is that we do have some examples and some lessons learned from communities around the country. And one of the things when you're structuring or thinking about what kind of model you want to implement in your community is thinking about community need and investigating that need, maybe by doing surveys of people in shelters or with unsheltered people, interviewing either people in your own organizations who have conducted similar kinds of programs or in other programs in your community. And I think it's really important not just to look at community needs, but a health ambassador program should also reflect and leverage the strengths and community resources in your community. So for example, this doesn't include just program resources, but also provider strengths, and also what about your community of peers? Who are the people who have been living with homelessness or serving people experiencing homelessness? How to leverage those kinds of supports in your community, because that's really going to be the strength of any program you implement. So a couple of examples that we have, next slide, is there are multiple different types of models based on the needs of your community and what you already have in your community. So for example, a site-based program could be leveraging sites where people who are experiencing homelessness are already coming for services and supports. So something like a needle exchange, other kinds of clinics, maybe it's an emergency shelter, maybe it's a monthly event where people come for support and services for people experiencing homelessness. Making sure that there's access to that site is really critical in order to build that trust-based relationship. Also combining, leveraging existing street outreach or street medicine programs. And as most of you know, those are programs that are going out to sites, that are really conducting outreach into where people experiencing homelessness are. And using a peer ambassador or a health ambassador model can create in-reach in those sites. And so maybe there's leaders that you may be working with there, but helping to align those outreach programs with health-based sites as well. Or there could be a collaboration that combines both of those things. So maybe you're working not just with street outreach or street medicine, but there's a monthly site-based program as well. Right, so just really collaborating with existing programs can be a really helpful way to start, but also looking at the gaps in the community where those programs don't reach. Next slide. And again, thinking about community resources and strengths as you're looking through the elements of the design of your program. So for example, your staffing model. Now this includes not just people who are staffing, your traditional vision of staffing, but your ambassadors themselves. Are you going to be viewing them as an employee or a contractor? Are they going to be part-time, maybe an event-based contractor where they are just working at that once a month site-based event? Or are they going to be more like employees where you're giving them training opportunities to advance in the services or healthcare field? There are examples of both of those. And I think depending on community need and resources, both can be really effective. But thinking about what that's going to look like, not just as a one-time event, but over time. Looking at compensation, and this is very important. And as Jillian says, it's great that this funding source will build that in, because that can be something that is really challenging for organizations to find funding for compensation. But for those ambassadors, how are you going to be compensating them? There are different models that really range from kind of commissions, what I like to think of a commission-based model, where maybe they're just getting a gift card for any in-reach that they make or people that they're connecting with, or it can be somebody who's on salary and is being paid to attend trainings, being paid to do the outreach, and being paid to really be an ambassador in the community. And then there are also, how are you going to staff it? Is it going to be within one program, or is there going to be a partnership or collaboration among programs? We really have found that in communities, those programs that really align with each other, that are building on healthcare and people who are mostly serving and working with people who are experiencing homelessness, really build strength in the community, not just for the program you're designing, but for future program and future healthcare incentives. So looking at that as you're building out your program. So say you're not, even if you're going to just have a program-based one program, where are you going to recruit ambassadors? How are you going to make those connections? How are you going to be able to keep in touch with those ambassadors on an ongoing basis? And those are some of the things that your partners can provide. Also, who's going to be doing the data collection and analysis? Who's going to be the administrator of compensation? Things like that. So those are all fairly standard, but when you're working with people who are experiencing homelessness, it's really good to have another lens on how some of those things may function. Next slide. And just real briefly, we put up a slide of a couple of examples that were centered around COVID vaccine ambassadors. And so there was one it was a healthcare for the homeless program that worked with emergency shelters. And one of the things that was really a hallmark of success for this program is prior to launching the program, they surveyed shelter staff to better understand vaccine hesitancy and fears among shelter clients, because then they had some ideas about how best to reach those clients. They also had more of a hybrid model where they administered vaccines through a mobile van unit, but in partnership with street outreach teams, but also were visiting shelter sites and at medical offices. So they had the mobility to go different places to meet the need. They partnered with the shelter guests to serve as ambassadors, and that can have some advantages because there's some stable locations, they'd be able to contact them, be able to pay them, and also they were very representative of the population that they wanted to make connections with. Another different model was a county health department that combined with community-based organizations. And one of the hallmarks of success for this program is that they reached out immediately to an existing program that was employing people experiencing homelessness. So they were selling a newspaper that was written and directed by people experiencing homelessness, and they already had the inreach into the community. And so they expanded that program and was paying an hourly rate and focused on helping those vendors move on to full-time jobs. The vendors conducted street outreach regarding availability of vaccines. They were able to discuss and pass out information, and they were also able to take advantage of training provided by local university and street medicine programs. And I believe in this program and some others, a large number of those folks moved on to full-time employment in related fields. So again, those are two different programs, and we're looking forward to seeing some of the other program designs, but I think it really does get back to looking at the strengths in your program, in your community, and how best to leverage them to move them forward. So next slide. So as was mentioned, Homebase is really excited to be able to offer technical assistance to grantees. And what can we provide? Next slide. One of the things that we hope to be able to provide is really creating forums for idea exchanges, so that grantees can work with other grantees. We can pass along information through meetings, as well as through the creation of toolkits and maybe some checklists and some other fact sheets that really will help strengthen different types of program models, so folks can learn from each other. Really want to exchange those ideas and give folks ideas about how to address challenges, because with any new program, a challenge is going to occur, right? And we also want to help center those ambassador programs within the homeless system of care. We know that in many communities, those systems may be under-resourced, and it can be difficult for healthcare systems to really bridge that gap. And we hopefully can provide some examples or ideas on how to do that. And I think that's all that we have. Am I right, Jillian?
Yep, I think we can pass it back over to Sierra. Thanks.
Right, but look forward to any of your questions, and we'll be looking in the chat as well.
Thank you, Homebase. And I know that there's a lot of questions coming in, and I still would like to go through the kind of the funding opportunity overview, because I'm hoping that'll answer some of those, but I will answer one or two right now. And that is, yes, this is being recorded. The recording and the slides, a PDF version of the slides, will be posted on our website. And at the end of this presentation, we'll have the link to that website. It won't be emailed out, but it will be posted to our website. So we encourage everyone to go to the Health Ambassadors for People Experiencing Homelessness page on the center website. You can see shfcenter.org at the bottom of this slide, and then the direct link will be shared at the end. So yes to recording, and we will get to some more questions here momentarily. And somebody is asking, when will they be posted? As soon as we possibly can, but we do have to make sure we can download and upload and all of those things and partner with our communication staff. I'm hoping early next week. So now we'll go over the funding opportunity. So we are seeking applications from organizations such as CBOs to provide ongoing outreach to people experiencing homelessness, feel more confident about the COVID-19 vaccines, and we'll link them to testing, resources, and other health-related services through a health ambassador model. This project will span just under 2 years. Talking a little bit more about the scope of work, some of the outcomes of this project are increasing vaccination rates and testing for COVID-19 and other illnesses for people experiencing homelessness, strengthening partnerships between stakeholders in the homelessness system of care and local public health and healthcare systems, identifying and documenting best practices and lessons learned to support scale up and sustainability, and providing connections to healthcare and housing related resources and information for people experiencing homelessness. We talked a lot about peer ambassador models, so I won't go over this too much. Move on. And Homebase will provide technical assistance to grant recipients, and they discussed that a little bit as well. So I will move forward. So eligibility, you're probably wondering if you are eligible to apply. This is all outlined in the RFA, but you must be located in California and provide services in California, are a 501c3 community-based organization, government entity, or a not-for-profit health provider, have demonstrated experience serving people experiencing homelessness. And applicant organizations and their partners must have evidence of inclusivity and shall not discriminate based on race, color, religion, creed, gender, gender expression, age, national origin or ancestry, disability, marital status, sexual orientation, or military status in any of its activities or operations. The use of project plans, the use of project funds must focus on engaging with people experiencing homelessness to better understand community barriers to testing and vaccination for COVID-19 and other illness. Also empower ambassadors with the information and resources to address those barriers. And additionally should describe any existing partnerships, street outreach, or backpack medicine programs and healthcare initiatives this program would build on, as well as partnership development opportunities with homelessness, housing, and public health stakeholders. So some potential funded activities. Potential funded activities could include the cost of recruiting, training, and compensating health ambassadors, equipment such as computers or phones to support health ambassadors, staff time and relevant expenses for convening, planning, and implementation sessions with program partners and key stakeholders, setting up data systems, data collection and reporting, participation in technical assistance activities. The award range for this opportunity is $100,000 to $250,000 for 18 months. And if you're awarded, you should expect to use your funds to support health ambassadors. You can also use staff training, program development, and program administration may be included, and you're expected to participate in technical assistance. And if awarded, you'll be required to submit regular reports every 6 months, and we will provide a reporting template. This will also include financial reports. And we will pause here now for some questions. I'm going to ask Andrew to help me cover some of the questions that are in the chat. And I see we have one hand raised. Janine, Janine, if you wouldn't mind putting the question in the chat so we can make sure it's documented for the FAQ. Thank you. So Andrew, what questions do you have?
Yeah, thank you, Madeline, and thank you everyone for sharing your questions in the chat. There's quite a few. So one of the first ones that was asked was, would this awarded funding have the flexibility to use an evidence-based model such as PCH, as long as they hire community health workers with lived experience and collect any other data outside the PCH model that Sierra Health would require?
Ike or Molly, do you have an answer to that specific question?
I'm so sorry. I did not actually, could you repeat the question?
Yeah, absolutely. So would this awarded funding have the flexibility to use an evidence-based model such as PCH, as long as they hire community health workers with lived experience and collect any other data outside the PCH model Sierra Health would require?
So I think I understand the question. So PCH being, I'm like, I looked this up actually, person-centered healthcare. Sorry. Is that?
Yeah, let's come back to this question. And if the person who asked it can define PCH so we make sure that we're answering the right question, that would be helpful.
All right, awesome. Next question was, is there a required financial match in terms of the budget?
There's no required match.
Okay. And then another question was, is there any required partnerships needed for this program?
Ike and Molly, I believe partnerships are not required but encouraged. Is that correct?
Correct. Yeah.
Correct. Yep.
Awesome. And then another question is, if we offer vaccines at our organizations, can we budget for incentives for getting vaccines?
Ike and Molly, are incentives for vaccines an allowable expense?
Yes.
Yes. Oh, that was going to be my answer, Beth. Go to the source.
But one thing to say is that there may or may not still be also state programs that provide incentives. So you want to look into that to make sure that you might be able to stretch your dollars further if, for example, you can get that money elsewhere for those incentives. But sure thing, yeah.
And then next question is a full audit required or is an audit review okay?
I don't believe an audit is required. A W-9 is required.
Awesome. And then the next question, with regard to staffing models, are stipend interns serving as peer health ambassadors aligned with expectations?
Are stipends for interns allowable? Ike and Molly.
I think it would be situationally dependent, but probably assuming, like I heard the word peer, so assuming that intern is a person with current or recent lived experience of homelessness, that should be okay. We do want to make sure that those stipends are high enough to be fair, right? To really provide some kind of a living wage.
Yeah, I would review the equity portion of that. Next question.
Awesome. And then, so there were a few questions around, first, how are you defining homelessness?
I'm going to turn to CDPH on that as well.
I don't know that we actually have a specific answer for that. So I don't have a good answer for you. I'm sorry.
We will put a definition or try to answer that question in the FAQ document. Is that all right, Molly?
Yeah, I think we're going to have to do that.
And then I guess a follow-up question similar is someone asked, are people staying in transitional housing considered homeless? Not sure if we want to answer now or include that in our FAQ as well.
Yeah.
I'd say yes to that one.
Yeah.
And then the last one around the definition, someone mentioned that many people who are houseless or unsheltered do not identify as homeless for many reasons. And so can PHAs reflect the same experience with being houseless?
Mike and Molly?
Can you say that again? I don't think I caught the whole question.
Yeah, so they asked, many people who are houseless or unsheltered do not identify as homeless.
Mhm.
And so can PHAs reflect this same experience with being houseless?
I guess I don't know what PHA stands for.
I think it's the public health ambassador. I think it's
Oh, great. Okay, perfect. I think so. Yeah, I think so. As long as they fit into like a regularly accepted standard of homelessness, right? Do they not have a permanent, stable place to live? Then I think that that would work. What we can also do, just so you guys know, I think that like the on the spot Q&A is a little bit challenging. So we are going to go ahead and like any question in the chat, we'll do some background research and post that on the FAQs. So don't worry if we sound a bit of a mess. We will sort it out.
We want to make sure we give you an accurate answer. So we will refer back. The FAQ will be that resource. And some questions may need review by CDPH management. So we appreciate your patience.
Do you want me to continue with the questions? It's quite a few.
Sure. I'm trying to there. I do notice that somebody asked about peer stipends being paid in cash. We're at a compensation level so that people don't get bumped off. I think I want to also emphasize when you do your budget, you will also be asked to submit a budget justification. And that is your opportunity to explain why your expenses are the way they are, including those types of limitations. And so I think that I encourage you, if there are if there are very specific reasons why you are setting amounts the way you are, then you need to be detailed in that. Some of these questions I see we're going to cover in the upcoming slides, like the indirect rate and other things like that. So I say we should move on. There's a lot of questions and we will post in the FAQ. I did want to answer one of them. I'm sorry, I'm scrolling. It says the developed program have to target all homeless people, or can it target a specific group? I think you could make the case for what is the best for your peer model. If you have a specific group of health ambassadors that you would be using to reach a specific group, I think that would be fine. I don't think that we can offer percentages of successes a lot of times, and especially around health emergencies, you're not going to know that information. And then I would also say, I'm sorry, there's a lot of questions. The how many grants are being awarded is dependent on how many apply and the levels of which the budget levels of which they're applying. So we will give out as much funding as we have available. And we will go through more budget items and things like that. And the FAQ will be available as soon as we can get the answers to your questions. And there was one last question I wanted to answer quickly, and now I can't see it. I'm sorry. There's a lot. But so I apologize.
Was it the fiscal sponsorship question?
What was the fiscal?
Bethany had said, my question is fiscal sponsorship possible? Can you apply if you are 501c3 status pending? Yes, you can.
Yeah. And fiscal sponsors are fine. Somebody did ask, can you do health ambassadors unrelated to COVID? And I believe that the funding source for this is for COVID specific. So I believe that the COVID-19 vaccine must be included in your program design, correct? My CDPH colleagues?
Show you this.
I believe so.
Yes.
All right. We're going to move on. I know that some folks are asking about the data metrics. I don't know that we'll be collecting like personal health information, but we will double check with CDPH and get back to you. I typically, I think that you would collect kind of like total number of served and such like that, but not specific information on people. We are going to move on. So the application process. This is an online application. This is kind of a screen grab. The link in the RFA will take you to this. You can also reach it on the website. You fill out this online application form. I do want to note, there's this little click box up here. It says save my progress and resume for later. So if you do want to come back to it, make sure you click that box. I do recommend preparing your answers outside of the grant application form, just so that you have them and you don't run into any technical difficulties. So the general start of the application includes the applicant organization information around your CEO or director, contact information, and for questions related to the proposal. Then we ask more specifically about the project and ask that you include a brief project purpose statement. This purpose statement should be about 100 words, and it generally should list the outcomes at the start. So, and then how they'll be achieved and any area or population and be specific. So kind of an example of one from an asthma home visitation program is to create an asthma home visiting program for African-American young adults in the county of Sacramento that will provide asthma education and home remediation. So please be specific in your purpose statement and include your outcomes at the start. We will also ask for your requested amount and the area that the project will impact. There are 12 narrative questions. I'm not going to go through them all, but they're listed in the RFA, so you can refer to them there. But they cover the description of your organization, the need, your goals and outcomes, your track record with the proposed focus population, project activities, the track record with proposed project activities, staffing, equity implementation, partnerships, monitoring and evaluation, organizational capacity, and additional funding. I'm going to go through the attachments. So the required application attachments include your proposed project budget, the budget justification, your W-9, a support letter signed by the applicant organization's administrator or executive that could outline that you'll follow the grant requirements, and a support letter and or a written agreement from partners if applicable. So you will be able to download a form for your budget from the application and then upload it here. The same with budget justification. And then you'll be able to upload your W-9 and your support letters. Your support letter from partners need to be included into one PDF because I believe there's only one link. I'm going to talk a little bit more about budget. So like we mentioned, the budget form, the template is provided. So you want to download that form, fill it in, and upload the completed form. So here's what it looks like. And so starting from left to right, I'm going to walk you through some of the columns. On the far left is the line items column. The top part, we have salaries, and then other kind of common expenses, but there's also a miscellaneous list where you can list in other items not already listed. The indirect rate is 20%. Next, we have on this next column is the full-time equivalent. This really gives us a good sense of the staffing, especially if you're providing staff for health ambassadors. Needing to know what the full-time equivalent of each staff person listed for this project is. Usually this listed in a decimal. So if your executive director will spend 10% of his or her time on the project, you would enter that as 0.10 on the FTE line. So we want to understand the time spent on the project for salaries. So the total project budget, this is the amount of the total project budget. And then the next column is the amount that you're requesting from CDPH for this project. Then the last column is that any other committed funding to this project. We want to make sure that this is committed funding, that the not pending applications or what you're hoping to raise, but money that's funding that's already been awarded, and including any other funding your organization's received for this project. All right, and then there are multiple year sheets. So one for year one and year two, and they add up. And they should automatically calculate for your total budget. So you do not need to fill in the amounts on the total budget form, but you do still need to fill in the line items because those will not carry over. So like I mentioned, budget justification, this is important. We require a separate budget justification from the budget template itself. We provide a template, but you can use your own document if you prefer. Your budget justification should describe each line item in detail. And for example, if you're requesting funds for travel, you would want to describe who will travel, where, for what purpose, and how you arrived at that request amount, like the number of trips for what number of staff based on the amount per mile. Another example, for staff and consultants, you could provide a description of that person's responsibilities for the project. Be sure to include detail for all items in the project, including those that you're not requesting funds for. and identify the source of other funding. So if you have in-kind contributions to the project, you should include those as well to give us a full understanding of the budget for this project. All right, now that we've talked about the application itself, we'll pause again for questions.
Thanks, Madeline. So I tried to kind of organize some of the questions around different topics. So first, around eligibility, there were a few questions around that. So the first one is, are public housing authorities eligible as government entities?
And Molly.
Let's get back on that one.
Okay.
And then another question, I guess more for the center, is that what if they are already receiving funds from the center? Would they still be eligible for this RFA?
Yes. And
Awesome.
I should note that your contract for this funding would be with the California Department of Public Health. So the center is administering the grant application process, but your contract will be with CDPH.
And then are organizations with existing CHW programs eligible to apply?
Yeah, if you are, I would think so. I can let Pike and Molly chime in, but you know, if you have a program, an existing program, you could apply.
Yes.
All right, and then there's another question. If we are not 501c3 yet at the time of application, but are expecting approval by fall, should we apply under our fiscal sponsor using their W-9 or apply as our own entity? Again, they won't have the status until July 20th, including their W-9.
We will come back to you on that question just to double check with CDPH's contracting department. But I would, I think that my recommendation would probably be to apply under your fiscal sponsor just to be safe.
I agree, Madeline, but I think, yeah, we'll double check and put that one in at the FAQ, but I would agree, apply under the fiscal sponsorship.
And then another one, can the budget be for an existing program that will incorporate the HA, or should the budget reflect only the health ambassador portion of the program?
So it's like the health ambassador part, the health ambassador thing is part of a much bigger program project. I am honestly not sure what would be most helpful to reviewers. I think you should make that call based on how you're framing your application.
And then if there are no project partners, then is a letter of support not required?
No, you do not need letters of support from partners if you do not have them, but the letter from your administrator or CEO or director is required just so that we know you're committed to fulfilling the expectations of the funding.
Awesome. Okay, and then some programming questions. So will the center provide training for health ambassadors, or are there designated training providers, or are the grantees to obtain their own training for the health ambassadors?
Homebase, do you want to just reiterate the technical assistance that's available?
Sure, I think I can come back on video, sorry. I think the specifics of it will be based on community need as well, and we'll work to actually define the parameters of it with folks who actually receive the grants and so are requesting TA. But in general, it's meant to be pretty flexible, and so it will be community-specific, grantee-specific support that you need to not just connect with partners and figure out like your actual, the like more details in the implementation of your program, but also doing some future thinking and sustainability planning for how to embed the program in ways that can be sustainable past the funding period. Hopefully that answered the question. If not, let me know and I can elaborate a bit more.
Yeah, so that's what is available.
And then is COVID-related work a required component of this grant? If we already have health ambassadors for COVID, but wanted to use this grant to fund health ambassadors doing work with other health issues and illnesses, is this allowed?
The COVID-related work is required.
And then for this funding opportunity, the health ambassadors would need to focus. Do the health ambassadors need to focus specifically on physical or medical health? Would it be acceptable for health ambassadors to focus on mental health as well?
Health ambassadors should be primarily focused on vaccine, on COVID-19 vaccines. And then if there are other health related things, including mental health, I think that would be fine. Pike, Molly?
That's correct. Vaccines, testing for COVID, because that is the federal funding that is behind all this. But yeah, auxiliary health services that can be linked as well would be awesome. But definitely can't be the main or only thing.
And then does the developed program have to target all homeless, or can they target a specific group or age? So for example, a program that focuses on senior homeless individuals.
You could target on a specific group or age, just make sure that you describe that in your narrative and the need and all of that.
And then I think there was a few questions, but I think they were already answered in the chat.
I saw some folks asking about the deadline. We're going to go through that here in a minute, some more timeline things. I'm conferring with CDPH. We're hoping to have the FAQ posted by Monday or Tuesday. So I don't think we will delay the deadline at all. I know that you probably want answers right now, but you know, we will do the best that we can. So we appreciate your patience, but we are dedicated to getting you answers that you need. And yeah, we do appreciate all of your questions. You know, it's always complicated to apply for funding. So you do not need to provide the COVID vaccine. That's correct. You need to provide the resources that they need to be able to make an informed decision about the COVID vaccine. Yeah, increase education and awareness. That's correct, right, Molly and Pike?
Yes, that being said, I want to not totally definitively answer that, because it is possible that some of the outcomes would be like number of people who newly were vaccinated as a result of this program. Does that make sense? Like that could very well be a deliverable. So I want to get back to you on that one.
Okay. And we will come back to the incentives in the budget as well. Andrew, any other questions?
No, I think there was just a general concern around if there's the possibility of extending the due date just because of, you know, it'll take time for the FAQ.
Like I said before, we plan to have the FAQ available Monday or Tuesday. So I don't believe we need to extend the deadline. Yeah, I do want to emphasize, you know, there is a project end date. And so we want to make sure that those receiving funding have as much time as they possibly need for to do the work funded. All right. COVID-19 is just one element. Like yes, COVID-19 must be included, but you can provide other health services as well. All right. Does the word count include spaces? I'm honestly not sure because we are using Salesforce for this application, and I will double check.
Yeah, I could actually answer that. It should not count towards the word count.
Thanks, Andrew. Shall we move on? We will have another last space for questions. I saw somebody asked about scoring, and we're going to go through now how to be competitive. And we're going to talk about the selection criteria. So reviewers will be looking at this specific selection criteria. We don't have a scoring matrix like you see in some public funding, but we do have this selection criteria, and all reviews are based off of this. So the application should really provide a clear explanation why the organization is the appropriate one to implement the Health Ambassadors for People Experiencing Homelessness project. And that includes, but is not limited to, a track record of successfully being led by, serving, or partnering with people experiencing homelessness, experience providing culturally appropriate services to people experiencing homelessness from a diverse range of backgrounds and communities, application of trauma-informed care, harm reduction, motivational interviewing, and cultural humility approaches, commitment to hiring and nurturing the skills of people with lived experiences of homelessness, and where possible and desired, to assist with linking ambassadors to ongoing work opportunities after the program ends. Competitive applications will demonstrate the use of an equity framework that recognizes the need to focus health intervention resources on communities that bear the heaviest burden of health inequities due to systemic racism, ableism, poverty, and other structural conditions. A comprehensive engagement plan that is responsive to the evolving COVID-19 pandemic, and prevention and education that is tailored and utilizes a stigma-reducing approach. Competitive applications will demonstrate your organizational capacity through staffing, partnerships, program strategies, and approaches to provide a comprehensive health ambassador program that is culturally responsive and linguistically appropriate for those who are being served. And demonstrate the organization's capacity to implement this project and plans for capacity building where applicable. Your application will affirm your ability to submit progress and financial reports every 6 months, and your participation in technical assistance and learning exchange activities. This is where that letter from your director or CEO is very important. So just a few proposal writing tips. You want to make sure you read and follow the application guidelines and instructions. You want to verify that your organization is eligible. Answer the questions clearly and provide enough detail about the proposed activities so that reviewers can fully understand your plan. And clearly explain your proposed project and what change will result from receiving funding. You should not assume that the review team is familiar with your organization or your project. You want to make sure you check for consistency in the project description, budget narrative, and budget line items. I'll tell you that myself as a reviewer always make sure to look back at the budget narrative, and see how it matches up to the project description. A great tip is to have someone who's not involved in the project to read your draft application and tell you what they think you're applying for. And then be sure to review the attachments checklist to ensure you have all the required documents. And here is that checklist. So review those application instructions and criteria. You want to complete the application questions, the project budget justification, the W-9, the support letter, and then, if applicable, support letters from partner organizations. And I would double check if you're scanning W-9s or other things. Just double check your files to make sure you're not uploading something blank. I have seen that happen. Our timeline, the deadline is July 20th at 1 p.m. We hope to announce the award in late August so that funds will be available in September. And we will take more time for questions, but I wanted to make sure to leave this up. If another question comes up, please email it to centergrants@shfcenter.org. Be sure to include health ambassador question in your subject line so it goes to the appropriate staff person. And then we will update the FAQ document and get back to you with that question as well. That is the website that we mentioned, so shfcenter.org. And if you go to the programs and initiatives, you will see a specific page for this program. All right, I see some more questions coming in, so we have more. And thank you, Jillian, for putting that into the chat. We do not need a current audit or financial statement. We need a W-9. This is not a, well, I'm not sure on cost reimbursement. CDPH, how does how are funds distributed for this program? Do you know?
I do not actually know. So we
We'll
will
talk
find out.
contract. Yeah, we'll talk to the contract department. Certification for health ambassadors. What certification training is required? I don't believe that health ambassadors are required to be certified. But they should be supported. Can anybody else weigh in on that?
As far as the TA would be available, yeah, I'm not aware of any certification that's required for health ambassadors in general, but part of the TA can certainly be setting up and figuring out what kind of training and support you would need or want to provide to your health ambassadors.
Yeah, so we encourage ambassadors to be offered training and to be supported, but certification is not required. Andrew, are there any other questions?
Yeah, I think one just came in. Is providing housing readiness activities allowable for this grant?
Molly, I think you went off mute. No, maybe not. Maybe I was wishful thinking.
Well, we can get back to you on that one.
Right. And then I think.
Wait, one thing I just want to say is I think it would be important to specify which kind of housing readiness activities you're thinking about. We do want to make sure that the focus is on COVID and health first and foremost, though.
Thank you.
Thanks. And I'm not sure if I missed this earlier, but there was a question around, can you hire peer supporters as well as peer ambassadors? So peer supporters, I think they mentioned, is people who have experience working with homeless, but may not have the lived experience.
We feel like it's pretty important. Yeah, I'm gonna say we really have a strong preference for people with lived experience. You know, although now that I'm saying that, I'm like, I don't know, I do know some outreach workers who've been out there for years and know everybody, so maybe we'd look at that on a case-by-case basis. You'd have to make a pretty strong case for somebody who doesn't bring lived experience.
Awesome. And then I think circling back, there was the question around the PCH. So the applicant clarified that PCH stood for Pathways Community Hub. I think it's just a evidence-based model of doing the work. So they were just asking if using a different evidence-based model, would that be appropriate as long as they hire community health workers with lived experience and also collect data that are outside of the evidence-based model that Sierra Health would require.
I think that's a tough question to answer because it's hard to know without getting in the weeds, and you could certainly apply and make the case. I know some of it is kind of, names. Some folks call people health ambassadors. Some people call them community health workers. Who maybe the activities are the same. So Pike, Molly, I don't know if you have further clarification that you would want to elaborate on, but.
I think I would need to look into that program a little bit more. I would say, I know if they have lived experience and it's recent or current, then that's one thing. I know community health workers tend to have a good amount of certification and training. So I think it would depend on the proximity, if that makes sense, in part. Just, how engaged are they currently with homeless community stuff? Just, what kind of trust do they bring? But again, we would consider it. I think we just need a little more information about the specifics.
Thanks. And then I think there was 2 questions around, compensation. So again, we might have to revisit these questions, but I just wanted to share. Are compensated volunteers to be compensated through a commission-based rewards, or is it up to the org?
Molly or Pike, do you know if there are compensation requirements for volunteers?
Frankly, I never liked that language in the RFP because I don't understand what it means. So I'm not going to answer that question because I don't know.
We will check with the contractors.
Yep.
And then another question is, if a homeless person is found capable, can they be helped through this grant to help house them, training, and prep for hiring?
And I saw that Molly asked if that is the person who would be the health ambassador, and it looks like Connie is saying no, just to help a homeless person get out of homelessness. So the fundings would, I do believe that, it is focused on recruiting those who would be the health ambassadors and then help that individual with their. It depends on how, this is like a tricky specific situation because I don't know what the COVID related services would be and things like that.
I think, are you asking could you use this funding to cover somebody's housing expenses and other things to get them out of homelessness? Is that the question?
In addition to providing the vaccine resources?
Right. Yeah, I would say honestly, probably not. That would probably be not an allowable expense. Really what the I think original intent was is to get this as a form of income for folks. But and so you could maybe figure out a way for them to earn enough to pay for their housing, but I don't think we would necessarily reimburse for housing expenses directly. Does that make sense?
I certainly want you to help them connect to health resources as well.
Yes.
We will answer that more fully in the FAQ. Somebody is asking if this is being recorded. This will be recorded, yes, and it will be played or shared on our website as soon as we can get it up. Any other questions? Like I mentioned before, you can email questions to centergrants@shfcenter.org, and we will be posting an FAQ document, hopefully Monday or Tuesday. And we will update that as additional questions come in. All right. With that, thank you so much for everyone for your wonderful questions. And I'm truly excited to see all the passion that is coming through in these questions. And so thank you for joining us today. We will get these materials up and out and ready to go. So thank you again. It is 11:30, so we're going to go ahead and end the webinar. I appreciate you all being here today. Thank you.